There was this one woman who came to our health camp in the very beginning, and she brought her daughter with her. And her daughter's name was Cynthia. And when she came into our clinic, she immediately broke down in tears and told us a story of how she could no longer work because she was older. And her daughter Cynthia, who was this beautiful, innocent little child of about 8 years old, in the background of the stories, playing with a little paper crane that we had made her. And as I'm listening to this mother and seeing her tears come down her face, I'm looking at this child in my peripheral vision and just seeing her future unfold in front of me, that ultimately she's going to be put to work because her mother can no longer work. And in that moment, I knew that we had to really save this child, that the time to intervene was now. And ultimately, we were able to work with the mother and get the child to a safe place outside of the brothel, really ensuring a different kind of future for her. And that's the kind of work that Partners for World Health is doing. I just love this place so much, and everything we do is so important, and it impacts people on so many different levels.
From NPR News, this is All Things Considered. I'm Robert Siegel. Hospitals throw away millions of dollars every year in the form of unused supplies. Well, Josie Huang of Maine Public Radio reports on how healthcare workers are finding a new home for those supplies overseas.
Elizabeth McClellan has been a nurse for more than 30 years, and she still can't get over how many perfectly good items hospitals throw out. So she and other nurses in Portland, Maine go around to nearby hospitals, bagging up supplies to give to health clinics in developing countries.
Partners for World Health is an organization that I started back in 2007, and we collect discarded medical supplies from different hospitals and nursing homes and private individuals throughout the state of Maine and 3 hospitals in New Hampshire.
This is where we assemble equipment that we're going to be taking on medical missions, and specifically on surgical medical missions. Here, in these 30 bins that we have right here, it contains everything that we need to be able to perform major surgeries literally in any hospital on this planet.
When you come down to visit us, you'll notice that we have bags and bags of medical supplies that all were headed to the dump. And now we have taken ownership of all of those bags of discarded medical supplies, and we are organizing them and repackaging them and making them available to people that are less fortunate than we are throughout our world.
Who cares?
Nationally, they feel that statistically we're probably collecting about 6% of what actually is going to the dump. And it's not necessary. We can take ownership of all of that. Think about the 94% of the stuff that's still going to the dump. I want all of that. I want that 94%.
Partners for World Health is about people. It really is about people helping people. I've been here for the last 3 years as a volunteer. I'm the volunteer medical director, and I've had an opportunity to see many people come and work in this organization. It's a chance for everybody to give back in a very special way.
It is true that Partners for World Health is an organization that I started out of my house. And when I started collecting these bags of medical supplies, I didn't have a place to store them, so I brought them into my house and I filled up my cellar, which overflowed into my laundry room and my downstairs bathroom, which overflowed into my kitchen, which overflowed into my dining room, to the point where I couldn't move. And when I moved all these medical supplies out in 2009, we had 11,000 pounds of discarded medical supplies that had been stored in my house.
I think once you've been here and you've seen the amount of stuff that's wasted, you just kind of keep on coming back. It's very addictive, in fact.
It's not what you did individually, it's you as part of a whole. You know, the people that, the surgeons who go to Bangladesh, you know, there were 3 of us this year, and I think that we did a lot of good while we were there. We would have been unable to do any of it if it hadn't been for the people that were at the warehouse that were packing the equipment to start with.
We have this recycle program where we leave these white bins and educate the housekeepers and the nursing staff to collect all of the items that are left behind in a discharged room. In addition, we work with materials management and the storeroom in these facilities and identify things that they've decided to replace which could be small items such as latex gloves being replaced by non-latex gloves, or it could be larger items like an operating room table because the capital equipment budget purchased another one and it's already arrived, or exam tables and stretchers and beds and bedside tables and over-the-bed tables and wheelchairs and crutches. And so if we as an organization can ship 12 containers, one a month for 2014, that's pretty impressive for a state of 1.2 million people. And for 39 hospitals to be able to say that we are collecting all of these medical supplies and we're going to fill 12 loads, 12 container loads, and each container likely has a value between $200,000 and $250,000 worth of donated medical supplies that ordinarily would have gone to the dump. And these are things that people need. If you don't send sutures and you don't send dressings and you don't send a pulse oximeter and they don't have a decent operating room table to do surgery, then doctors and nurses cannot do their job.
Imagine going to a hospital in a remote area in a developing country. You look around at their equipment, you look around at their supplies, you look around at their doctors and nurses, and most importantly, you look around at their people. They don't have anything. There's no way you can perform these surgeries, there's no way you can take care of these patients if you didn't have the tools that you need, if you didn't have the supplies that you need, the equipment that you need.
The impact of delivering these supplies is pretty powerful. You know, when Partners for World Health travels on a medical mission trip, everyone who's going takes a 49.5 pound bag of medical supplies with them. That's pretty amazing. And in those bags, we bring every single thing that we need to do surgery, to do nursing education, to be able to leave medical supplies behind.
Partners for World Health believes that if we are going to go on a medical mission to these countries, that we will do no harm. So we come with a smile and with a sense of energy and a positive attitude that we accept everything that we see, even though so much of what we see is so different from compared to what we have in the United States, that standards are so much lower than what we would expect. But that's okay, because at least they're trying and they're doing the best that they can with the limited resources that they have.
It's one of those intense shared experiences that you just never forget.
I've been doing medical missions for over the past 20 years, and I can honestly say it never gets old. It never gets old. Oftentimes these trips are sort of a group of doctors and nurses and staff. You get 15, 20 people sometimes together, and half of them have been on mission trips and some of them are new. And I still feel just as excited as the new people, even though I've gone to these places many, many times.
And so when we arrive with our medical supplies and our smiles and our energy, and we just want to help them, we are received with open arms. They're so excited to have us there, and it becomes an incredible experience of sharing emotions, of me sharing my emotions with people that have so much less, and they're sharing their emotions with us, and it's a major connection. It's an absolute incredible emotional connections that brings tears to your eyes when you're about to leave, because you realize that you're leaving them behind, yet you made a big difference in so many people's lives.
I love the fact that it's a totally volunteer organization. Everybody here is a volunteer, and people are very enthusiastic.
It was the best vacation of my entire lifetime because it was filled with gratification. There were all these wonderful moments, and you know, I can remember a few events from my trip to Aruba, but I can actually relive every event of my trip to Tanzania.
We are here to stay. And even though we are run entirely by volunteers at the moment, we do realize that 2014 is a big year for us because we need to grow. And in order to grow, we need to raise some significant funding so that we can hire some people. One to be our development director, one to be a warehouse manager, another person who can be our volunteer coordinator and really reach out to the community, and all these other volunteers that would be to find volunteers that would be interested in coming down and helping us.
I would encourage anyone who has some free time on their hands chance to come on down, see what we're all about, become a part of it, become part of our family, because that's really what it is. It's a big, giant family, and we're doing really important work.
We identified one little girl this year as someone that we wanted to really put the time and energy in to take her, to make sure that we could get her out of the brothel, and we were very successful. And some people might say, well, you're only making a difference in one child's life. That's true, but that's the first child. And so that's the beginning. All it takes is one bag of medical supplies, and now look at where we are. So now we have one child. That's number one child. And there will be more children as we go forward.
Every day that we were at Shears Ganj, we would go to the hospital and operate, but in the morning we would go see the patients that we'd operated on during our time there, and essentially, do pretty informal rounds with the patients. And every day we'd go see this lady, and every day she would just hold our hand, and in Bengali she'd say, "Thank you, thank you." It was pretty amazing seeing the smile that just lit up her face every day.
Just knowing in your heart that you did the right thing. That's what we're all about. That's what Partners for World Health is all about.